Rise yet again to provide the Assembly with an update on the COVID-19 situation in the ACT and the actions taken by the government to protect the health and wellbeing of Canberrans. Since my last update on the 5th of April 2022, the COVID-19 situation in the ACT has remained relatively stable and our public health teams have continued their preparations for the upcoming winter season. As always, I'd like to thank Canberrans for their continued efforts to protect themselves and the people around them from COVID-19. Canberrans have been outstanding in adhering to the latest public health advice and practising COVID-smart behaviours. As a result, we are well placed in our transition to managing COVID-19 differently. Madam Speaker, the COVID-19 situation across Australia has also remained relatively stable over the last month, and case numbers across most states appear to have reached a peak and begun to plateau. The ACT Government will continue to work with other jurisdictions and consider advice from the Australian Health Protection Principal Committee, or AHPPC, as we move through the national plan to transition Australia's response to COVID-19 and into the winter season. Here in the ACT, as at 8 p.m. on the 1st of May, there have been a total of 105,739 cases since the start of the pandemic in March 2020. There were 5,725 active cases with 66 COVID patients admitted to hospital, 2 of whom were in intensive care. Sadly, there have been 52 deaths since the start of the pandemic, and the ACT Government expresses its sincere condolences to the families and loved ones of these individuals. As at 9 a.m. on the 2nd of May, the ACT had conducted 994,339 negative tests, and there were 1,748 individuals who have declared as household contacts in the ACT. As I previously noted, positive rapid antigen test results for COVID-19 have been collected by ACT Health since the 8th of January. Through the introduction of an online rapid antigen test declaration form that members of the public are asked to complete if they test positive on a RAT. All RAT declarations, including those with limited demographic information, have been included in ACT Health's daily COVID-19 case counts from the 8th of January. During routine data cleaning work conducted by ACT Health in April, 846 incomplete RAT declaration forms were identified and removed from the cumulative ACT COVID-19 cases total. These incomplete forms contained limited demographic information and/or the legal declaration had not been completed. Records with insufficient demographic information, including name, date of birth and phone number, were removed by ACT Health, as these records could not uniquely identify an individual. With this limited information, ACT Health was unable to determine if the person had already completed a RAT declaration, nor contact the person for case processing, and therefore could not apply their standard business rules, such as confirming if the person had in fact sought a confirmatory PCR test. In addition, records were removed because individuals did not complete the legal declaration section in the RAT form. There are 3 components to the legal declaration, including stating that the person has tested positive to COVID-19 in a RAT test or interstate PCR test, acknowledging that the information collected by ACT Health may be shared with other government agencies, and declaring that the information provided is correct to the best of the person's knowledge. Madam Speaker, the ACT's world-leading COVID-19 vaccination program continues to provide Canberrans with good protection from the risks of COVID-19. I'm pleased to report that in the ACT, 80.7% of 5 to 11-year-olds have been vaccinated with the first dose of the vaccine, and currently 65.2% are up to date with their vaccination, having received a second dose. 97% of all Canberrans aged 5 years and older have now completed their primary vaccination course, and 75.1% of eligible Canberrans, those 16 and older, have now received a booster or third dose. Following approval by the Australian Technical Advisory Group on Immunisation, we've also begun providing second booster doses or winter doses to eligible Canberrans. These additional booster doses will ensure that people at greatest risk of severe illness from COVID-19 are as protected as possible as we head into the winter season. This includes people aged 65 and older, Aboriginal and Torres Strait Islander people aged 50 years and over, residents of aged or disability care settings, and people aged 16 and over who are immunocompromised. As of the 1st of May, 13,451 eligible Canberrans have received their second booster dose. I encourage everyone who is eligible to come forward to boost their protection against COVID-19. I'd also like to take the opportunity to encourage Canberrans to get their flu vaccination. Flu vaccines will be particularly important this year, as it is expected that fewer public health restrictions and the return of international arrivals will drive an increase in flu and other respiratory illnesses this winter. Madam Speaker, influenza can be deadly. I strongly encourage Canberrans to protect themselves, their families and their community by getting their flu vaccination. Canberra Health Services is experiencing high demand across their health facilities while facing staff shortages due to COVID-19, other illnesses and approved leave. To boost resources in more acute areas, including the emergency department, some changes to less acute services have been made. This includes, from the 26th of April, the COVID-19 mass vaccination clinic has been reduced to operate between the hours of 8 a.m. to 5 p.m. 7 days a week. There were 143 vaccination appointments that needed to be changed, and the ACT Health Bookings team has contacted all affected patients. The AIS vaccination clinic will continue to offer a walk-in service during its opening hours. Madam Speaker, the ACT Government's Equity to Access program also continues to make a vital contribution to our vaccination program. The program ensures that every member of our community can be vaccinated and protected against COVID-19, regardless of their personal circumstances. The Equity to Access program was scheduled to wind up at the end of April 2022, but we're now looking at an extension to 30th of June. In 2022, the Equity to Access program has administered a total of 879 COVID-19 vaccine doses through a combination of in-reach vaccinations to homebound individuals and pop-up clinics arranged through non-government partner organisations. Of these, 53 have been winter or second booster doses and 506 have been first booster doses. In the past month, suburban pop-up clinics have taken place in dispersed locations throughout Canberra, including Lyneham, Charnwood, Canberra and Turner. In addition, the Equity to Access program provides opportunistic vaccinations across the ACT's public and private hospital network to inpatients who are not up to date with their vaccinations. Canberra Health Services also collaborates internally with services such as mental health teams to provide home visits to some community members for a COVID-19 vaccination. The program has also been providing in-reach vaccinations to the Alexander McConaughey Centre and Bimbri Youth Justice Centre. Canberra Health Services has also partnered with Calvary Public Hospital Bruce to deliver a needle phobia clinic. The needle phobia clinic is for community members who have a severe needle phobia and are unable to receive a vaccination through mainstream clinics or primary care. The clinic has been in operation since December 2021 and has vaccinated 17 people with at least one dose, with 15 of these having received a second dose and 3 people booked to receive boosters by the end of April 2022. The clinic also provides an avenue for patients to receive other vaccinations or blood tests to monitor their health while under sedation for their COVID-19 vaccinations that they would otherwise be unable to access. I want to thank the staff working to provide this important service. Many of the people accessing this clinic have had traumatic experiences during previous vaccination attempts. The feedback we've received tells us that being able to access this dedicated service has had an enormous impact on these individuals' health and wellbeing. Madam Speaker, on the 31st of March, AHPPC published its statement on winter season preparedness. The statement recommended that any changes to TTIQ requirements or test, trace, isolate and quarantine should only be made following the anticipated peak of the current Omicron BA2 variant. The Commonwealth Chief Medical Officer subsequently advised the Federal Minister for Health that Australia has reached the peak of the Omicron BA2 wave and that therefore it would be an appropriate time for jurisdictions to change the way close contacts, that is household contacts, are managed. The ACT Chief Health Officer considered this advice in the context of the ACT's epidemiological situation and advised the ACT Government that such changes could be implemented here in the ACT. As a result, on the 21st of April, the ACT Government announced changes to TTIQ requirements, including the management of household contacts, in line with the advice of AHPPC and to align with New South Wales and Victoria wherever possible. With effect from 11:59 p.m. on the 26th of April, household contacts are no longer required to complete a mandatory quarantine period provided they comply with certain risk mitigation requirements for a period of 7 days from the last time someone in the household tested positive for COVID-19, with the date of collection of the test regarded as day 0. A household contact is now required to advise ACT Health that they are a household contact by completing a COVID-19 online declaration form. Wear a face mask in all indoor spaces when outside of the home if aged 12 years and over. Work or study from home where it is practical to do so and where it suits the employer and employee. Notify their employer and/or educational facility that they are a household contact, and this will assist employers and educational facilities to determine whether the household contact can work or study from home or can attend the facility following an assessment of risks in accordance with work health and safety obligations. If it is not practical to work or study from home and there is mutual agreement to attend work or study, the contact must undertake COVID-19 testing and return a negative test in the 24 hours prior to returning to work or study, and then every 48 hours if ongoing attendance is required. If needing to attend a gathering that is unavoidable, they must have returned a negative COVID-19 test result in the 24 hours prior to attending. Finally, Madam Speaker, household contacts must not enter a high-risk setting, such as an aged care facility or hospital, unless they reside there or need care, noting that high-risk settings can consider granting exemptions from this requirement. Household contacts are also expected to practice COVID-smart behaviours and, as much as possible, avoid attending crowded places, spending prolonged periods of time in indoor spaces with others, and interacting with people who are at high risk of severe illness. Any household contacts who are symptomatic or cannot comply with the risk mitigation requirements will be required to quarantine for 7 days. The ACT Government acknowledges that quarantine requirements have resulted in workforce pressures in many workplaces and businesses. We hope that these changes will ease those pressures and assist Canberra businesses to return to normal operations in a safe and considered way. It is also our hope that these changes will reduce the burden of quarantine on families and individuals, improving the wellbeing of Canberrans. It is important, however, for the community to still be conscious that household contacts continue to be at greatest risk of developing COVID-19 compared with other people in the community. Canberrans should therefore continue to do everything they can to minimise their movement within the community and exposure to others, particularly those at highest risk of severe disease if they are household contacts. Workplaces and businesses also need to ensure that they put in place appropriate work health and safety protocols if there is mutual agreement for an employee who is a household contact to return to the workplace. It is important to note that all asymptomatic household contacts will be allowed to temporarily leave quarantine to vote in the federal election on the 21st of May. However, they must wear a face mask and return a negative result in the 24 hours prior to attending a polling place. There are currently no changes to isolation requirements for confirmed COVID-19 cases. Individuals diagnosed with COVID-19 must continue to isolate for 7 days. Once recovered, they do not need to isolate, quarantine or test for 12 weeks from their date of clearance. ACT Health does advise recovered cases to still stay at home if they develop any respiratory illness symptoms during the 12-week period to avoid transmission of other viruses, particularly as we head into winter. In addition, from 11:59 p.m. on the 29th of April, the ACT Government removed quarantine requirements for unvaccinated international travellers intending to travel to the ACT. It should be noted, however, that these travellers may still be required to seek approval from their port of entry to onward travel to the ACT, as not all jurisdictions have removed quarantine requirements for unvaccinated international travellers. All international travellers are still strongly encouraged to get a COVID-19 test within 24 hours of arrival in Australia if they intend to travel to the ACT. Madam Speaker, the ACT Government has also made changes to COVID-19 risk mitigation requirements within schools and early childhood education and care settings for the start of Term 2. From 11:59 p.m. on the 25th of April, the requirement for face masks to be worn in indoor spaces at schools and early childhood education and care settings was removed from the Public Health Direction. It is still recommended that masks be worn by adults and students in Year 7 to 12 when in small indoor settings, excluding general classroom settings, where physical distancing is not possible, when required to do so through a public health direction, or when otherwise required by employers as part of work health and safety arrangements. Staff and visitors to school sites will no longer need to check in using the Check-in CBR Act under a public health direction. Schools and ECECs are asked to continue displaying their QR codes for voluntary use and for use by event organisers who hire school facilities where there is a requirement for check-in CBR to be used. School systems and independent schools and ECECs now need to consider the potential implications of these changes and review their COVID safety measures. In regard to ACT public schools, the Deputy Chief Minister announced that they would maintain Term 1 restrictions for the first 2 weeks of Term 2 to enable appropriate planning and consultation to take place. Madam Speaker, the standing exemption for essential workers has been revoked due to the changes in the management of household contacts, which permits individuals to attend their workplace under similar requirements previously outlined in the standing exemption. However, for the sake of the public record, I note that prior to these changes, the ACT had extended the essential worker standing exemption for household contacts to federal election workers. This included any person employed or engaged on behalf of the Australian Electoral Commission to perform functions of election delivery. The updated standing exemption was commenced from midday on the 14th of April. This was in addition to previously exempted workers in the food and grocery support, freight and transport, veterinary services, community pharmacy and national security. A temporary exemption was also issued to the Canberra Airport from 6 a.m. on the 14th of April until 11:59 p.m. on the 25th of April. This temporary exemption covered security workers and airline check-in and baggage workers and reflected the workforce pressures being experienced at the Canberra Airport at a time of increased demand for services over the school holidays, Easter and Anzac Day long weekend. Madam Speaker, for an increasing number of Canberrans, COVID-19 can lead to debilitating symptoms that last for months after the initial infection has subsided. For some people, this can include fatigue, poor sleep, reduced respiratory capacity and very reduced exercise tolerance. These symptoms can impact a person's ability to return to work, exercise and engage in social activities and family commitments. The recently opened post-COVID recovery clinic at the University of Canberra Hospital is taking an individualised approach to assisting patients with symptoms impacting on their daily lives more than 12 weeks after contracting the virus. Eligible patients are aged 16 and over and considered clinically stable and appropriate to undertake a physical rehabilitation program, having identified achievable, time-appropriate rehabilitation goals. These patients can seek a referral from their GP and are then supported through a specialist rehabilitation program run by an interprofessional team seeing a rehab medicine specialist, physiotherapist, occupational therapist, exercise physiologist and social worker. Most patients also have a respiratory assessment through the Department of Respiratory and Sleep Medicine at Canberra Hospital. There is a significant ongoing collaboration between the respiratory team and the team at the post-COVID recovery clinic. The rehabilitation is provided at UCH with an option for home-based functional rehabilitation if needed. The rehabilitation pathway may include one-on-one therapy, group therapy including pulmonary rehabilitation, self-management education and telehealth interventions. This clinic is playing an important role to help Canberrans return to their pre-COVID activities and live a full and happy life. Madam Speaker, the Chief Health Officer has provided me with her 25th and 26th reports on the status of the public health emergency due to COVID-19, which I now table. These reports outline the actions taken by the Chief Health Officer and ACT Health's COVID-19 response team in the 30 days to 6th of April and up until the 2nd of May. In her report of the 2nd of May, the Chief Health Officer has advised the government that she intends to revoke the public health directions that require vaccination for workers in the healthcare and education settings in the ACT from 11:59 p.m. on the 13th of May. The revocation of these vaccination requirements is based on updated advice from the Australian Health Protection Principal Committee on mandatory vaccination for high-risk settings, which no longer extends to workers in healthcare settings and does not recommend mandatory vaccination for education workers. The Chief Health Officer is also satisfied that the high level of vaccination coverage across the eligible population aged 5 years and over has reduced the risk of outbreaks and poor health outcomes in primary schools and early childhood education and care settings. Vaccination requirements will still be in effect for workers in aged care and disability and other care, as the risk of outbreaks and severe illness among people they care for remains high. This approach is also consistent with the national advice. The Chief Health Officer will continue to monitor the need for vaccination for these workers to ensure our public health directions remain proportionate. Madam Speaker, the health and wellbeing of our community remains of the utmost importance, and the ACT Government will continue to provide Canberrans with up-to-date public health advice as we head into winter. While we acknowledge that changes to test, trace, isolate and quarantine will likely lead to an increase in cases in the community, these changes will also assist businesses and workplaces that have experienced significant staff shortages and will improve the wellbeing of individuals who become household contacts. The ACT's nation-leading vaccination coverage and continued compliance with public health advice puts us in a great position to be able to tackle the winter season and the challenges this may bring. Madam Speaker, I present a copy of the statement and move that the Assembly take note of the paper.